You pick it, we play it. This is Request 879
on Radyo Katipunan 87.9 FM.
Pagbati po mga Katipuneros, this is Cardinal Chito Tagle. Join me every week on The Word Exposed on Air, here on the Voice of the Blue Eagle, Radyo Katipunan 87.9 FM, the Ateneo Campus Radio.
The Voice of the Blue Eagle, Radyo Katipunan 87.9.
Blue Eagle, kami di mapipigil sa pagbabalitang tumpak at tama. Buhay Atenista, sa loob sa labas ng eskwela, ating ibibida lahat ng eskwela. Radyo, Katipunan, Radyo, Katipunan, Kawan ni Ignacio, sugod, todo sa kayod, tulong at tulong. Lipad na Blue Eagle, galing hiding at gigil. Blue and white, one big fight. Radyo, Katipunan, Radyo, Katipunan,
Coming up next, Cura, Conversations on Care, Health, and Healing on Radyo Katipunan 87.9 FM.
Radyo, 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 Katipunan, Radyo, Katipunan, Radyo, Katipunan, Radyo, 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 Katipunan, Radyo, Radyo, Katipunan. Voice of the Blue Eagle, kami di mapipigil sa pagbabalitang tumpak at tama. Buhay Atenista, sa loob sa labas ng eskwela, ating ibibida lahat ng eskwela. Radyo, 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 Katipunan, Radyo, 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 Katipunan, Radyo, Radyo, Katipunan, Radyo, Katipunan. Kawal ni Ignacio, Katipunero, sugod, todo sa kayod, tulong at tulong. Lipad na Blue Eagle, galing giting nagigil. Blue and white, one big fight. Radyo, 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 Katipunan, Radyo, 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 Katipunan, Radyo, Radyo, Katipunan, Radyo, Katipunan, Radyo, 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 Katipunan, Radyo, Katipunan.
Health isn't just about medicine,
It's about care
community,
and conversation. That's why Radyo Katipunan brings you Cura, your campus medical show.
From everyday wellness tips to expert advice on the health issues that matter most to you.
Cura is here to listen, guide, and care
The Ateneo way.
Join us as we talk about healing
Hope and health right here on Radyo Katipunan 87.9 FM.
Cura, your campus health companion
Where care meets conversation.
Magandang gabi, Ateneo. Welcome back to Cura Conversations on Care, Health, and Healing. I'm Dr. Tibi Sumpay-Cotachaco, and today I'm flying solo again. Dr. Jello is at the conference, but we have an incredibly important episode for you tonight. So today po, we're talking about something that strikes fear in many hearts and quite literally heart attacks. And kanina po, binigyan tayo ng ating guest this evening. Binigyan niya ako ng heart attack dahil sabi niya ang cura daw ay on Tuesdays at hindi Monday. So halos umatay ako noon. Heart attack moment yon for me. But here's why this conversation is so critical. In the Philippines po, alam nyo, cardiovascular disease is the number one cause of death. And every year, thousands of Filipinos have heart attacks. And many of those deaths could be prevented with knowledge and quick action. So yan po yung isa-share sa atin ng ating speaker, no? But here's one thing po. People don't actually know what a heart attack is. They've been seen dramatized in movies. Yung talagang hihimatayin, napaka-dramatic, no? But is that the real thing? Often, very different, and that confusion can cause precious minutes that could actually save a life. So today po, we're demystifying heart attacks. We're going to explain in plain language what's actually happening to your body. Meron pa po kaming visual aid dyan mamaya. Tapos, how to recognize the signs, because it's not always that chest clutching and collapsing, and most importantly, kailangan natin pag-usapan, what will we do when we see signs of a heart attack? And then, we're going to spend some time talking about prevention, because here's the empowering truth. Heart attacks are largely preventable. The choices that you make every single day, what you eat, how you move, how you manage stress, these aren't just small things. They're actually life-saving things. And whether you're young and think this doesn't apply to you, or middle-aged and starting to worry, or already managing heart health, this conversation could literally save your life or the life of your loved one. So, eto na po. Let's talk hearts, how to protect them, how to recognize when they're in trouble, and how to act fast when every second counts. So, ngayong gabi po, sabayan niyo po ako sa pag-welcome ng ating incredible, actually Superman po siya talaga. Ang Superman guest natin ngayong gabi ay si Dr. Jude Erric Cinco. Dr. Erric is a cardiologist, critical care specialist. Past president po siya ng Philippine Heart Association. Dr. Erric is an assistant professor at the Ateneo School of Medicine and Public Health and is section head of the adult critical care at the Medical City. So magandang gabi, Doc Erric, na nag-heart attack sa akin kanina.
Good evening, Doc TP. Good evening, everyone. Pasensya ka na, hindi ko matiis na hindi kayo good time.
Oo nga, parang feeling ko talaga.
Magandang gabi po sa inyong lahat. Thank you for joining us tonight.
Ayan, so maganda po yung pag-uusapan namin ni Doc Erric ngayon, ano. Pero Doc Erric, you've been on the front lines of cardiac emergencies for years. Pero yung unang tanong namin, what made you choose cardiology? At hindi lang yun, dinagdagan mo pa, critical care. Bakit ito yung napili mong field?
Okay. Pwede po bang bumati? I'd like to
Bumati
greet
ka muna,
our
tama.
Ateneo School of Medicine and Public graduates of class 2025. 100% tayo sa physician licensure exam. Yay!
Shout out sa ating batch
shout out.
2025. Congratulations!
Congratulations! Proud of you, doctors. Yan.
Sige.
Okay. Cardiology is a very interesting field. It's a discipline that comes after internal medicine. Tapos yung critical care naman, very challenging siya. Yung patients at the most sickest end up in the ICU. And there's so many things to think about when you are handling a critically ill patient and putting this all together, siguro siya yung pinaka-interesting na science for me when it comes to medicine. So sa mga bagong graduates, please think about IM, cardio, and critical care. Okay, thank you.
Yung pala, recruitment po pala to
Recruitment,
sa ating mga kaka-board exam. At siguro hindi lang galing sa ESMPH, di ba? Parang
Yes,
yun
all our
ang...
listeners.
So, tandaan po natin, ang gusto lang ni Doc Erric yung talagang challenging. Kaya yun ang mga fields na pinili niya, no? And Doc Erric, ito, may isa pa akong question sa'yo. As past president of the Philippine Heart Association, you've seen the landscape of heart disease in the country, no? So what keeps you at night about Philippine heart health?
I wish po sana that the Filipinos will invest in health. Yun talaga yun, yung ang bottom line. Even yung colleagues namin abroad, yung concept natin kasi dapat yun, lahat ng disease, all diseases, may socio-cultural aspect yan. No? Tapos may control tayo. We have control, like you said. No? We can do things to help our heart. To our listeners, you know, your heart is working hard for you. We should also work hard for our hearts.
Ay, ang ganda niyan. Kailangan tandaan natin, no? Work hard for your hearts din. Okay, maganda yung ganung kind of relationship. So, Doc Erric, let's start at the very beginning, no? So, pwede mo bang i-explain sa amin in the simplest terms possible, ano nga ba yung heart attack? So, what is a heart attack and what is actually happening inside the body? Gusto mo ba ng picture?
Okay, may picture tayo.
Sige, maglagay tayo ng picture dito
So,
habang ini-explain mo.
So, Doc TP, at the outset, common question sa amin is, ano po ba ang difference between a stroke and a heart attack?
Sige.
They're
Sandali,
very similar.
Gusto ko yata yung isang picture. Try mo
A
na natin
stroke
isang
po is
picture.
atake sa utak. So pag pinag-usapan natin yung neurological o atake sa utak, yun pong nagkakaroon ng weakness in part of the body, yun yung stroke.
Okay.
When we're
Kailangan
talking about
i-differentiate
differentiate
yun.
natin,
Okay.
when you say heart attack naman, ito yung atake sa puso, yan, heart attack. So shown in the picture for everyone to see are 3 pictures po, no? You will see first a man clutching his chest, yan. For some reason, common siya na presentation.
Hahawakan mo
Oo,
talaga.
parang describe nga siya ni Dr. Levine, tawag Levine sign, no? Pag sumasakit ang dibdib mo, you tend to clutch your chest, ganyan.
Okay.
Ang tawag namin doon sa classic picture na yun, angina pectoris. You know you have angina pectoris kasi it's a different feeling. It has been described by patients in different ways. Hindi nga siya outright pain sometimes eh. Hindi siya sakit.
Talaga?
Sabi
paano
nila,
dinidescribe to?
parang squeezing, parang strangulating, parang heavy, may nakadagan, ganun, may nakadagan. Hindi talaga siya parang makirot, parang siyang, there is a vague pain, nakadagan sa'yo, hindi siya makahinga. There are so many attributes of the feeling. Tapos, more often than not,
Pero sa chest area ba lagi?
ayan, it's in the chest
action
area,
nila.
and then it radiates to the back, sometimes tumutugon or radiates to the back, to the lower jaw,
Okay.
to the arms, to the stomach, pero above the belly button, above the umbilicus. Yun yung radiation niya. Tapos, ang symptoms, may mga aspect siya. So, ang symptoms ng angina pectoris, precipitated siya by effort. Ibig sabihin po nun, matinding sakit na talaga yung kung wala kang ginagawa, biglang sumakit. Meaning, nagkaroon ka ng
Kunyari,
chest
nakaupo
pain,
ka lang.
nakaupo ka lang at rest. Pero in general po, it happens when you start doing some effort, walking, climbing up the stairs. Minsan yung stress, kapanood ka ng bad news, ganun. Tapos, sasakit. So, meron siyang ganung
Pag
thing
uminit
na
yung ulo nila bigla,
uminit ang ulo,
Yes.
something that precipitates it. Tapos, yung character niya nga iba-iba ng way to describe it, pero parang effort-related siya and it's relieved by rest. Yan. Pag medyo nagpahinga ka ng konti, kumalba ka, nawawala siya. Tapos itong chest po natin, may ibang structures yan. May mga pasyente po tayo, may GERD o gastroesophageal reflux disease. Akala nila nag-heart attack sila, pero hindi pala, hyperacidity lang pala.
Oh, okay.
Ang characteristic naman nun, you can differentiate kasi pag uminom ka ng water o nag-take ka ng antacid, it goes away. Naku po, ang heart attack or angina, hindi ganon. It just keeps on going. Tapos, you need to rest or take medications. Ang tawag namin doon, nitrates, no? You put it under the tongue for it to be relieved. Now, I explained angina pectoris kasi po yun ang herald eh. That's the warning sign that you may be having a heart attack.
Lahat ba ng taong nag-heart attack mararamdaman niyang angina pectoris?
More often than not, yes.
So, kadalasan,
Oo,
yun pala yung
kadalasan.
kailangan. So, may katotohanan pala yung mga sa movies na magka-clutch
May
ng
katotohanan
chest.
yun,
tas
yung
bigla
tipong
silang,
Ang tinuturuan po natin yung everybody na please listen to your body, di ba? You should see your doctor when you're feeling something strange. Kasi it does happen that a heart attack, all of a sudden lang, yung biglaan na lang na nangyari yung heart attack. Pero maraming patient po, if binalikan na lang history nila, may warning sila. There's some warning. Parang nagsimula muna sila na on mild exertion lumalaba, on moderate exertion pala, then mild exertion, then at rest, tas mamaya sabihin nila, a few seconds lang. Then naging minutes, then several minutes, yung pala heart attack.
So
na
may
pala
progression
yun.
siya.
May progression.
Okay.
So kung titinan natin
Balik
yung
tayo
picture,
dun sa picture,
kanina,
no? Ang ganda ng picture
classic
kanina.
picture of a man na nagka-clutch ng chest. That could be the precursor to a heart attack na po kasi the patient has been feeling angina pectoris before the actual heart attack. May warning na siya, may advanced warning na siya.
Ang ganda talaga nitong picture na to, Doc Erric.
Now, on an anatomical level, it's quite easy to explain to our dear listeners. Ang gawin niyo lang is take your hand, tapos ipitin niyo yung wrist niyo and you will understand what a heart attack is. Kasi po yung hand natin, may blood supply yan eh. May blood supply. Okay, if you feel your hand and you clutch your hand like this, then after a while, mawawala ng blood supply yung arm mo.
Parang nangangawit.
Mangawit, no? Tapos sasakit yan mamaya. If you do not release this pressure, naku, magkakasugat yan. Magkakaroon ng problem yung hand natin.
Parang nangingitim na yan.
Because all organs of the human body need constant supply of oxygen and blood and nutrients. So the heart po is a muscle. It has its own blood supply. Ang tawag natin na coronary arteries. So as shown in the picture there, the illustration, the drawing, so ito yung heart, is a muscle and may blood supply. Pwede mabarahan yung blood supply na yon. We'll talk about that in detail. Pero pwede mabarahan yon. At pag nawala na ng blood flow talaga yon, you will see in the other picture, which is a special x-ray called a coronary angiogram. Yan, coronary
Ayan yung mga
angiogram.
nababalitaan nating angiogram.
The picture on the left shows an arrow wherein the dye, the contrast dye, does not move forward. Putol, no? Putol siya.
Bitin, no?
Bitin.
Okay.
Nung binuksan in the cath lab, nagkita mo na yung blood flow. So yan po ang itsura ng heart attack. A before and after picture of a heart attack na nagbara siya, nawala ng blood flow yung muscle, nagsimula siyang mamatay, nagsimula magkaroon ng problem yung muscle. And then swerte, this patient reached the hospital, na angiogram, na angioplasty, bumukas, na-restore yung blood flow.
Ang ganda.
So, in a nutshell,
yes.
ang heart attack po, magbablock yung coronary arteries
So,
that supply the blood to the heart.
Para siyang plumbing problem.
I agree.
Na kailangan pala ng tubero para buksan
Yes,
yung
I
baradong pipe na yan.
It's
no?
a plumbing problem. Nabarahan yung ugat sa puso.
Okay. Ang ganda. Pero siguro ito, madali nang parang ma-visualize, no? Na ano nangyayari doon sa nagsusupply ng dugo sa ating puso. So, hindi lang pala yung puso nagsusupply sa buong katawan, pero
Yes,
kailangan niya talaga ng taga-supply sa kanya.
Yes,
no?
agree. Like any other muscle, it needs its own blood supply.
Right. So, thanks for that, Doc Erric, no? So, ako, ito naman yung tanong. So, what should people do the second they suspect a heart attack? Either for themselves or, halimbawa, yung family member nila. Pwede mo ba kaming i-walk through the step by step? Kasi ngayon, parang, okay, alam na natin ano yung dapat pala bantayan. Sabi mo, may mga subtle signs to begin with, di ba?
Yes.
Sige, please inform us.
Okay. So, if you suspect po that you have some form of angina pectoris or maybe a herald to a heart attack, hindi po siya nagagamot sa bahay eh. There is no treatment or remedy that you can
Kahit yung
do.
nitrates na sinasabi mo.
Kapag na-prescribe na siguro
Pag
yun.
na-prescribe, oo.
So, the prudent thing to do po is really to consult your physician and say that complaint because the doctors po are well-trained to detect kung may problema yan. There are many tests that can be done. Pinaka-basic po is an ECG. May mga blood test po yan. Some patients po kailangan i-provoke yung angina with a stress test, yung pinapatakbo sa treadmill, titignan mo kung nagpapalit, ganyan.
Okay.
Meron ding mga dobutamine stress echo. And then lastly, may mga patient who end up on an angiogram, yung titignan mo talaga kung nagbabara ng ugat sa puso. Ayoko naman pong takutin kayo. Hindi naman po lahat ng chest pain is heart attack. Kasi nga may muscle tayo dyan, may bone, sometimes
Paano kung
yung esophagus.
kaka-exercise mo lang? Pwede ba yun?
Oo, if you're a healthy person who just exercise, tapos upper body ang ginamit, tapos sumakit, chances are, mas malaki chance na it's muscle, no, rather than a heart attack. Kapag yung masakit, yung joint in the rib, tapos you can take a finger and then point and press on the rib, tapos masakit lalo. chances are it's just the rib. Costochondritis rather
Hindi pala
than
siya heart attack.
heart attack. So, ganun po talaga please, wag po kayong mag-risk. Do not take the risk na try to treat a heart attack or angina at home. Please consult your doctor.
Okay. Sige, babantayan natin yung mga signs. Pero Doc Erric, parang we usually hear like heart attack or cardiac arrest. May difference ba yung dalawang terms or pareho ba sila?
Okay. Thank you, Doc TP. Pag sinabi po natin cardiac arrest, tumigil na po yung heart. Yun po. Nag-stop na yung pag-beat ng heart. And unfortunately, in our country nga po, like you said, siguro siya na yung pinaka-common cause ng pag-stopping of the heart ng cardiac arrest, ang heart attack. So if you get a heart attack, your heart can go into cardiac arrest po.
Sige, so important din siguro yung clarification na yun, ano. Doc Erric, like in the Philippines, alam din natin may traffic. Can you like describe, ano ba yung kailangan nilang gawin? Diba, halimbawa, parang emergency na talagang merong pain, constant siya, hindi ma-relieve ng rest. Ano yung pwede nilang gawin papunta sa ospital?
Opo. Kailangan po lahat tayo, especially if you're somebody who's not so young anymore, tapos may mga risk factors ka for coronary artery disease, you should be conscious on how to call for help. Yan. Call for help. Kasi nga po, pag nagka-traffic na po talaga and you do not reach the hospital in time, meron kaming kasabihan time is muscle. Habang tumatagal yung time na mabuksan yung coronary siya na nagbara, lalong nadadamage yung muscle. So, it's a race against time. You need to get to the hospital right away if you're having a heart attack. So, if you're caught in traffic, tapos wala kang magawa, the best thing for you to do is call for emergency services. Because, ang mga Pilipino naman po, we respect yung mga ambulance, di ba po? No? Kapag dumadaan yung ambulance to come to your rescue, pinapadaan naman natin yun kahit heavy traffic. And that's my best advice po to you. So, you reach the hospital alive.
Okay, so at least meron pa rin silang pwedeng gawin. Tumawag ng ambulansya, wag na silang, di ba minsan nakikita natin sa mga kotse na nagpa-flag din sila na
Yes,
attempting to,
Yeah, marami tayong stories sa ganyan, no? Yung mga patient natin na na-caught in traffic, tapos ayaw pang pagbigyan, yung pala nagka-heart attack na. Although may mga success stories din tayo na nakinig naman yung mga kababayan natin sa flashing light and the driver shouting na, wait, let us through, may emergency kami, right?
Galing. Sige. Nandyan ang ating pagkamakabayan pa rin.
Kamakabayan.
Yes. Pero Doc Erric, ito may question. Si Sarah, sabi niya, how do I know if the chest pain is just indigestion? Sabi mo kasi kanina parang GERD, di ba?
Yes.
Versus anxiety or heart attack na ba to talaga? Kasi I don't want to go to the ER for nothing.
Ayan.
Di ba? Kasi parang ang mahal ng ER, nakakatakot.
Oh, that's true. Hi,
Paano
Sarah.
i-differentiate
Okay.
yun?
So, earlier we mentioned that there are certain characteristics that make you predisposed to have a heart attack. Ito yun Gender, being male, older age, family history. If somebody in your family had a heart attack in the past, may genetic component Smoking, yan. Sedentary lifestyle, absence of exercise, hypertension, diabetes, dyslipidemia o mataas sa cholesterol. Saka these days, yung lack of sleep from a disease called obstructive sleep apnea, yung mga nag-snore na gabi, ganun. So, if you have certain risk factors, chances are, meron kang coronary artery disease. On the other hand, kung wala ka namang risk factors, pwede pa rin, but the chances are smaller.
Okay.
And then may characteristic, Yung GERD, honestly, minsan masikid na kami, even the doctors, nahirapan kami sabihin na sa GERD lang pala. Nalalaman lang hindi yan, no? Pag binorkap mo na. Kasi ang GERD, nasa dibdib din siya, no? Masakit din siya. And the pain is so hard to characterize. Pero pag nakita na ng doctor na ECG looks normal.
Okay. So,
ganyan.
kailangan ng labs?
Kailangan ng labs, nakita mo. Tapos, minsan, you drink water, tapos you take an antacid, then it goes away. Tapos, on re-history, babalikan mo, umano pala ako nun. Ate something spicy.
Correct. Or galing akong inuman.
Galing akong inuman, empty stomach, I ate a lot of coffee, something like that. Yung mga, or soft drinks, may mga nagpe-precipitate sa kanya.
Okay.
Then, diagnosis ng GERD. So, to those po na nakikinig na you suspect you have GERD, it is better to rule out heart disease first. Kasi life-threatening yung heart disease And be glad na lang kung nasabi sa inyo na after all the workup, hindi pala siya heart, GERD lang pala siya. Easier na.
Oo nga.
Natatakot ako doon sa, GERD lang to, yung pala heart attack na.
Oo,
That's
dinisregard
scary.
mo na yung symptoms, tas yun na pala.
Now, anxiety. Anxiety is hard.
Okay. Mahirap din siya i-differentiate.
Oo, you really need labs kasi minsan emotional stress can precipitate a heart attack. Ganon din yung anxiety, no? Pero meron kaming konting clue.
Ano, may tip ka ba?
Yung heart attack kasi talaga, it causes a lot of other symptoms that you cannot make up. Ibig sabihin nun, beyond your control. Karamihan mo sa
example
nag-heart
nun?
attack they're cold, parang
Okay.
cold and clammy, cold sweat.
Parang pinapawisan sila, pero nalalamig din.
Tapos hirapang huminga.
Okay.
May nagsasabi pa nga, although dramatic sounding, they have a sense of impending doom. Yan,
Wow,
ganyan.
okay.
Ganun daw, no? So, ganun yung heart attack. Whereas yung anxiety, sometimes you can actually feel yung reason na na-trigger ka na anxiety, and then mas matagal yung symptoms of anxiety before it really bothers you. Parang it will take minsan hours, no? It
Yung
doesn't
onset niya mas dahan-dahan.
onset niya mas dahan-dahan, and when it starts yung pain mo mas matagal, ganon. Pero yung heart attack sa talaga, when a person has it, napapasugod siya sa hospital kasi there's really something there, ganun. As time goes on, the feeling gets worse, ganyan. Pero again, in all humility, kailangan nga rin talaga ng workup
I-rule out mo pa rin muna
rule out
heart
pa rin,
attack.
still do an ECG.
Yung pa rin yung
Get
una,
blood
no?
test, yes.
Oo nga, kasi parang very life-threatening siya talaga.
Siya life-threatening,
Yeah. Doc Erric, sabi niya, can someone who seems healthy, normal weight, exercises regularly, still have a heart attack?
Okay, the answer is rarely yes.
Okay.
So, there are certain diseases. Our friend Dr. TP here is a pediatrician. May diseases in childhood that you can get that can lead to a heart attack when you're young. May mga congenital anomalies, yung abnormal yung blood vessel ng heart mo. Merong Kawasaki's disease na you get aneurysms in the heart after getting it as a child. Ganun. So, yes, it's possible. Pero ano po yun? Mas rare po yun. And then, since we're talking about yung mga parang unusual cases, no? So, we show the picture wherein nabarahan yung ugat ng puso dahil may bara sa loob. You know, yung blood vessel, pwede siyang mag-spasm meaning doon siya mag-contract.
Sumikip siya.
Ganun. And certain drugs can do that, no?
Hala, anong klase?
Yung mga cocaine, ganyan, mga methamphetamine.
Oh, okay.
Or they can do that, they can cause vasoconstriction. Bibilis na yung tibok ng puso mo, magkoconstrict pa yung blood supply, it can present like a heart attack. So, everyone, don't do drugs.
Oo, tama. Makinig po tayo kay Doc Erric. Yes, so another reason kaya dapat don't do drugs. Sige, Doc Erric, ito naman. So, punta tayo ng konti sa prevention, no? So, halimbawa, nag-recover sila after a heart attack. So, if someone survives a heart attack and gets treatment, ano naman yung longer term outlook nito, no? Pwede bang bumalik sila sa normal life nila?
Yes, so yun po ang aming good news. With modern medicine po, timely interventions, you can still be gainfully employed after a heart attack. Pero may process po yun. You have to really do a turnaround. You have to realize the importance of lifestyle modification, adherence to the medications. Tapos you have to be very, very scientific. Ano po, susundin niyo po yung payo ng doctors. Alam niyo, pag nag-heart attack kayo, mahaba yung process, no? You end up in an ICU, in the cath lab, and then merong rehab, yung cardiac rehab, emphasize namin yun, very important.
Ano bang ginagawa doon, Doc Erric?
Guided exercises.
Guided exercises.
May nakakapit ng mga ECG, then you are not pushing yourself too hard, but gradually gaining back your strength. Maraming evidence yun na pag nag-undergo ka ng proper treatment, yung kompleto, mas mabilis ang recovery, mas matagal ang lifespan, lesser ang complications, and you can be gainfully employed. So there's hope naman po this day and age kapag meron na tayong heart attack.
Pero Doc Erric, di ba sabi natin parang yung blood supply sa puso nababarahan? Like, ano ba nangyayari dun sa muscle ng puso? Namamatay ba yun talaga? Nabubuhay ba sila ulit after this rehabilitation?
Yes. So unfortunately, yun pong heart muscle, pag namatay po yung muscle na yun, it does not really bounce back
Fully
anymore.
recover.
Doesn't fully back.
Okay.
And nangyari nga po on studies, nagiging scar siya. Parang peklat na lang siya, ganun.
Okay.
Kaya the longer the time na may bara, the more muscle damage there is, the worse it is. Kaya time is muscle. Kapag nagbara na, nagsisimula ng endanger yung mga muscle at na-restore, na ibalik yung blood flow doon sa heart, then malaki ang chance na marami pang part ng heart muscle ang mabubuhay and they will take over yung function. Kaya ganun po, yung pong other parts of the body, pag na-injure tayo, nag-heal Mabalik sa dati, ganun. Yung
pag
heart muscle,
tayo,
nagkasugat. Yung heart muscle, nagiging scar na lang siya. So, that's why this topic for tonight is very important.
Okay. Sige. punta tayo sa next segment natin, Doc Erric, no? So, let's bust some dangerous myths about heart attack. So, ready ka na ba, Doc Erric, for fact or myth?
I'll do my best.
Sige, let's do this. So, first one, if you're having a heart attack, you should take an aspirin and drive yourself to the hospital. Fact or myth?
Okay. Ang aspirin po is still part of the treatment na binibigay in the hospital setting. So, yung aspirin part may be a little bit true, pero yung drive yourself to the hospital, ako natatakot. Naku, doktor, naku.
May kwento ka ba tungkol dyan?
Oo, should call for help kasi may mga patients po kami who drove themselves, tapos lost consciousness along the way,
While
di ba?
driving.
Oo, nabangga, yung pala ganun, and may good Samaritan na naka-rescue sa kanya. So, therefore, the answer to that is, aspirin is one of those drugs that's being given for a heart attack, pero yung driving yourself may not be a good idea.
So, mas mabuti na tumawag ng kasama sa bahay,
Yes.
tawagin mo yung asawa mo, ganyan.
Or an ambulance.
Or an ambulance. Better
Oo.
ang ambulance
Yes.
talaga. Pero anong gagawin nila habang nag-aantay for an ambulance?
Okay. Kung this patient is a good kind of patient, meaning
Meaning?
simula pa lang may angina pa lang siya, nagpapatingin na siya.
Okay.
Baka meron siyang pill in the pocket. Yan. Baka meron siyang nitrates. Malaking bagay na yan. No? You take a nitrate that will buy you a little bit of time kasi magkakaroon ng better blood flow in your heart. So these patients po are parang better prepared. Ganyan.
Okay.
Ang nakakatakot talaga yung unprepared, yung bigla na lang, tapos ganon.
Paano nga yun?
Yun nga, kailangan talaga, you should really rush to the hospital and get to a healthcare facility. I wish there was something you could do at home, pero hindi po ganun kasi
Meron
yung
ba yung
heart
mga
attack
screening na parang, okay, hindi ako sigurado. Wala pa
Yeah.
naman akong heart attack. Meron
Oo.
ba mga screening tests na ginagawa for heart attacks?
Okay, may mga certain individuals tayo na whether it's company policy or on their own, nagpapa-check up sila. Di
Yung
ba?
mga executive
Oo,
check-up.
executive check-up.
Do you
They get
recommend that?
in the right person, it works, pero sa general population, sometimes negative naman, no? Pero personally, I like it na tinatest ka when you're of a certain age, if you have strong family history. Importante po, pa-measure nyo yung blood pressure nyo, pa-measure nyo yung cholesterol ninyo, and then take a history. Baka the things you take for granted pala are dangerous, like smoking. Yan, di ba? Naku, smoking is a big one. Ganyan.
Oo nga. Sige, o eto. Ulitin natin to ng konti, Doc Erric, no? Pero, critical distinction. Heart attacks always cause severe, crushing chest pain. Fact or myth?
Okay. It can be a myth po, yan. May mga certain patients po, for example, especially may diabetes.
Oh.
Opo, ang tawag nga namin doon, anginal equivalent. Hindi na siya exactly angina na classically described. Pero they just feel weird. Parang I feel weird. Parang nahihilo ko, na nahihirapan akong huminga. There's a strange sensation. But it's not the typical crushing, nakadagan, etc. So therefore, it's possible po that a heart attack can present that way.
Okay.
Can
Lalo
present
na
that
kung
way.
may comorbidity pala
Kung may
sila.
comorbidity, especially mga diabetic po, it can be a different feeling, pero heart attack na pala yun. So, you have to be very careful, especially when you have diabetes. But in the majority of cases, it presents classically.
Okay. Pero Doc Erric, di ba yung iba parang sasabihin nila, ang bilis ng tibok ng puso ko. Parang nagpa-palpitation.
Yes.
Pwede na ba yung presentation din ng heart attack?
Oh, yeah, I agree, yes. There are certain patients po, after nagkaroon ng heart attack, nai-irritate yung muscle ng heart. And they get some form of cardiac arrhythmia. There are two kinds. We have seen patients po na sobrang bagal ng heart. Yun yung tinatawag may heart block, nagka-heart block. Nagka-heart attack, ang bagal-bagal ng tibok ng puso and they feel it, na mabagal ng tibok. Meron din, as you described, nagpa-palpitation, sobrang bilis.
Sobrang bilis naman.
And the palpitation can be regular or irregular. Yan. So, depende sa ECG makikita. But yes, a heart attack can precipitate an arrhythmia. Whether brady or tachyarrhythmia, slow or fast pwede.
Okay, so arrhythmia, yung parang weird na tibok ng puso,
Weird na
mabilis
tibok
or
ng puso.
Okay.
Yes.
Sige, ito naman. Coughing vigorously during a heart attack can save your life. Fact or myth?
Okay, ayan po, that's really a myth. Nung kumalat po yan, siguro, how many years ago, di ba? Kumalat siya, no? Experts started disproving that na po kasi parang sinasabi daw that meron kasing medical procedure called Valsalva's maneuver. Ginagamit naman yung to terminate an arrhythmia, meaning yung may mga certain types ng arrhythmia na masyadong mabilis. Pag gumawa ka ng Valsalva's maneuver, like yun nga, yung
Ano ba yung Valsalva?
Yung you take a deep breath, tapos you pinch your nose, and then you iri, you
Iiri ka,
strain,
mag-strain,
ganon, or you cough, or you dip your face in water. There are certain tachyarrhythmias that can be slowed down sa ganon. So actually po hoax yun kasi yung person na nagsabi nun, hindi naman scientific yung yung basis niya na you can save. Nagbabara yung ugat sa puso and all you have to do is vigorously cut.
Parang pag inubo mo, maalis yung bara.
mawaalis yung bara sa puso. And in fact, ano po yan may mga advice po kami sa inyo, maraming fake news proliferating po ngayon. You should know how to, parang yung the skill to verify, ano yun, di ba? The skill to verify and search for the information. Ang favorite way ko po to share with you is to take the phrase na ginagamit nila and put hoax at the end. Minsan sa Google lang lalabas na, this is somebody disproved
pang-search ba
this.
yan?
Pang-search or yung search term. Coughing vigorously to prevent heart attack. Hoax, ganun. Mamaya paglabas na, doon na meron ng expert
May
na
evidence na,
nag-disprove.
may expert.
So ingat lang po kayo. So sorry po, that's not the way to treat a heart attack. Thank you.
Sige, parang hindi siya yung usual way of looking for evidence, but if it works,
If it works,
madali naman para sa layman na. Pero siguro si screen pa rin nila kung ano yung
alin
kung
yung
ano
hoax, alin yung
makikita.
true. Alin yung hoax, alin yung true. Natatakot kasi ako sa mga fake news talaga, no?
Nakakatakot yung
Takot ang fake news.
Lalo na to, heart attack pinag-uusapan natin, tas fake news
Yeah.
pala yung nandyan. O ito naman, another factor myth, Doc Erric, taking aspirin prevents heart attack in everyone. Mali, ulit, isa pa. Taking daily aspirin prevents heart attack in everyone. Fact or myth?
Okay. There is some truth to that sa mga older studies. Yan
Sa
kasi po,
older
in the
studies.
past po, alam niyo po kasi yung
Gano'n ka-old
aspirin.
yung studies?
My students pa
Student.
yata tayo, Dr. TP.
Ay, matagal na yan.
Kasi po yung aspirin po na medication is an anti-platelet. Yan.
Okay.
Pinaprevent niya yung clumping of the platelets. Kasama kasi sa heart attack yung pang-clumping of the platelets. So during that time, they only had aspirin to give to patients para mag-prevent yung clumping of the platelets.
Ano ba nangyayari pag nag-clump yung platelets, Doc Erric?
Pag nagka-clump na yung platelets,
Nagdikit-dikit
palaki ng palaki
sila.
yung clot. Palaki
Okay.
ng palaki. So if you can imagine a tube getting a small clog, habang lumalaki, over time palaki ng palaki yung clog until there's no flow anymore. Parado na completely. So in the past, yes, aspirin is part of the treatment. Alam nyo ngayon, we still give aspirin but never alone yan.
Oh, okay.
Dual antiplatelet
Anong
na ngayon. May mga
Dalawa?
kasama sila.
Okay.
May kasama sila ibang gamot. So aspirin plus something else. There are better drugs po na antiplatelet being given ngayon. So aspirin alone, in the past, yes. Ngayon po, there are better combinations with aspirin that are better.
Okay. Ano ba, Doc Erric, yung mangyayari? Kasi di ba parang aspirin, tapos magdadagdag pa ako, hindi ba duduguin na yung tao?
Oh yes, that's the danger. That's why po, ang recommendation talaga, a patient is closely watched. Ang mga naka-heart attack po, pang ICU talaga yan. Binabantayan Binabantayan mo kasi the medications to thin the blood, di ba, can cause bleeding.
So pag naging extreme naman,
Oo, so
sobra naman.
binabantayan talaga. Tama ka, no? That's the danger naman. That's the downside. You're trying to prevent a clot from getting bigger, or you're trying to bust that clot in the blood vessel, but you can have bleeding elsewhere. So, it's a happy balance, no? You need a happy
Right.
balance.
So kailangan mo talaga ng doktor, di ba, Doc Erric?
Yes, highly recommended
Na
po talaga.
nagsusupervise.
This is one of those diseases po talaga na wag niyong i-risk po, mga listeners. Wag niyong i-risk yung buhay ninyo. Kasi, di ba, ano yung kanta? Marami nang namatay sa maling akala, di ba?
May kanta ba?
May kantang ganun, Eraserhead.
Gusto mo kumanta?
Maling akala.
Sige.
Ang bottom line,
Sample naman, sample.
grabe. So, kailangan talaga po, listen to the good scientific advice po of our doctors. Please consult your friendly neighborhood cardiologist. Thank you.
Okay, pero thanks for those clarifications, Doc Erric, no? So, thank you for setting the record straight. So, ngayon, punta naman tayo sa prevention and lifestyle. Kasi this actually offers hope dahil meron tayong magagawa, no? So, pakinggan natin to. So, let's focus on what our listeners can do today to reduce the risk, no? So, Dr. Erric, we've gotten so many questions about prevention. Sandali, tignan lang natin. So, ito muna, galing kay Jennifer. Sabi niya, I'm 45, no symptoms, I feel fine. Do I need to get my heart checked? And what screening tests should I ask for?
Okay.
45 na siya.
Hello, Ma'am Jennifer. Yan.
Yeah.
Thank you for your interest in your heart health. Ma'am, I would recommend, number 1, for you to take your blood pressure.
Blood pressure.
Ano po, common misconception ng mga Filipinos na mag-high blood lang ako pag sumasakit yung bato ko. Oo. Inaral na po namin yan. Marami po tayong pasyenteng may hypertension na walang symptoms. Kaya it has a moniker, is called the silent killer, di ba? You don't know high blood ka pala. Oh. So Ma'am Jennifer, magpa-blood pressure po kayo. Even if wala kayong niraramdam, you feel perfectly healthy, minsan mataas na yung blood pressure, you do not know.
Pwede
Malaking
ba
bagay
nila
na
gawin
yun.
yun sa bahay? Sila
Yes.
mismo mag-monitor ng blood pressure nila?
Oh yes, we recommend home BP monitoring with a calibrated machine, yung properly calibrated po, reputable brand. May advice po kami pag magdi-digital monitor po kayo, when you wake up in the morning, go to the bathroom, don't take breakfast muna, sit in a quiet place, take your blood pressure, ideally 3 times po. Kasi yung digital, minsan yung first one mali, no? Importante yung reading number 2, saka number 3. Tapos take nyo po both arms, left and right. Yan. Kasi
May significance ba yun?
may significance.
Kung
Some
bakit
patients,
magkano?
iba yung left, iba yung right. Ang rule natin, you will take the higher of the two. Yung higher of the two.
Okay. Hindi pwede mandaya?
Hindi pwede mandaya
Okay.
Tapos ito po maraming permutations, maraming type ng hypertension May mga taong hypertensive lang sa office, normal sa bahay, hypertensive sa bahay, normal sa office. Kaya we advocate na not only do you take your blood pressure in the clinic of the doctor, but at home. So malaking bagay na yun for Ma'am Jennifer. Tapos Ma'am Jennifer, cholesterol, ipacheck niyo po yung cholesterol niyo. You saw the picture earlier.
Kahit parang payat siya, balingkinita,
Ay,
kailangan
opo.
parang i-check ba yun?
I-check pa rin natin. Oo. Kasi even yung mga pasyente po natin are payat, pwedeng mataas ang ating bad cholesterol. Okay. Pag nakita niyo yung lab result, merong number yon. Doc TP, ang ayaw namin doon sa number niyan, minsan may nakalagay na normal value on the side.
Parang may range kasi,
may range,
diba?
no?
Oh.
Hindi po totoo yung normal value na yun kasi po, the target is different per individual. Yan.
Okay.
So wala talagang normal value. For example, if you already had a heart attack, dapat the LDL or the bad cholesterol should be less than 55.
55?
55, gano'n kababa. So halimbawa, nakita ng patient, ay, mataas naman ako, nakalagay naman normal value, okay na ako doon. So bawat individual, may kanya-kanyang target. So don't pay attention to the normal value quote dun sa site. Consult your doctor kasi meron pong particular range that is appropriate for you. Pero in general, the lower the better. How do you remember LDL, the bad cholesterol? Lechon de leche. Bad cholesterol, LDL.
Ang galing. Lechon de leche po para matandaan ng bad. Ay, ang ganda niyang tip na yan. Pati sa
Cute
ating
ba
mga
yun?
med students.
Cute yung LDL.
Oo, cute. Lechon de leche.
Another thing you can do is check for diabetes. Ayun na po, marami po tayong pasyente na they realize too late na may diabetes pala sila. Yan, di ba?
Okay.
Some patients talaga, they have the symptoms. Pero minsan, nagkakaproblema pala even before the symptoms start. So,
Oo nga.
Ma'am Jennifer, pacheck
Right.
niyo yung blood sugar niyo. Baka mataas na yun, we do not
Ano
know.
yung kailangan nilang i-check? Kasi, Doc Erric, sabi nga nila, parang insulin resistance, mga 10 years.
Agree,
bago
no?
mo makita
Decades.
yung,
Oo.
decades talaga.
Marami tayong check na ginawa. Usually, is a blood test. Ganyan, our friendly internists and endocrinologists or even the pediatricians, meron silang mga protocol niyan paano mag-check ng blood sugar to see whether you're within the normal o nagsisimula na ma-impair, etc. So, do not just listen to your body in your case kasi you feel healthy. Pero it's good magpa-check up kayo every now and then. Then from those simple tests, no, a simple urine test,
Urine test
simple
din.
blood
Okay.
test, may mga clue sa urine, di ba minsan? May spillage of sugar in the urine, ganun. A simple urine test, a simple blood test, ECG may be helpful, taking your blood pressure. Sometimes a simple chest x-ray just see if your heart's shadow is normal.
Or baka malaki na pala.
Lumalaki na pala yung heart. There are certain things po that you can do. And ina-emphasize nga po namin yung Doc TP, don't think about health as a expenditure. Yung parang you're spending for health. No, hindi po. You're investing in health. Mamuhunan sa kalusugan.
Ang ganda naman. Investing in health. Lagi ko nga sinasabi, kasi kung ma-confine po kayo sa ICU, mas mahal pa yun, di ba?
Agree,
So, mas maganda
mahal.
na ngayon pa lang. Pero, so Doc Erric, meron bang age? Kasi ito, 45 siya. Meron bang age na, sige ba, kailangan ko na nga ipacheck yung cholesterol ko?
Ayan.
Or,
Thank you for that question. Alam niyo po, dear listeners, we are very sad, no? Kasi these days, ang dami ng younger individuals who are having a heart attack. Nagiging
Right.
younger sila.
oh, nakita mo yung trend?
Nakita namin yung trend. May socio-cultural aspect kasi talaga yung sakit eh. Nung araw, sakit yan ng mga lolo't lola natin. Ngayon, di ba? Ngayon, mommies and daddies na. Okay, I want to appeal to the listeners ngayon, to the parents, and to the, baka may children, ano?
Oo.
Doc TP, the youngest documented heart attack na nagkaroon kami, wala pang 30 years old, 20-something siya nag-heart attack.
20-something.
20-something, parang 27 yata. Tapos nung
Okay.
na-angiogram siya, all 3 vessels were barado na. Nag-heart
Tatlo
attack
na.
siya.
Sadali, ilang vessels ba yung meron dyan?
Basically,
Doc?
there are like 3 main. Parang
3 main,
tatlong
tas lahat nun barado na. Okay. At 27, Doc
At 27,
Erric,
alam niyo po
okay.
nangyari sa kanya when we discovered, 11 years old siya, grade school siya, meron siyang masamang barkada. They would go to the side of the school, at the end of the school, nag-smoke sila. Tumatakas sila. Pagkatapos ng school, nagkakaroon sila ng smoke break. Nag-smoke break yung bata.
Ilang taon?
11 years old,
11.
grade school. So, ano nangyari? A decade later, ended up in an ICU with a heart attack. So, ganun po eh. To the call center agents who are listening to us right now, naku, pag meron kayong break, wag na kayong mag-smoke break. Bakit kayo kailangan mag-smoke break? Mag-exercise break na lang kayo. Do something productive rather than mag-smoke break kayo. So, yun po. Sa mga magulang, sa mga nakikinig, napakasimple lang po nung prevention of smoking. Smoking po is one of those things that has 100% harm and 0 benefit to your health. Thank you.
Ang ganda nun, Doc Erric, no? Pero gusto ko yung, huwag ka na mag-smoke break, mag-exercise break ka na lang.
Diba,
At least
pwede
you're
naman,
giving
no?
them an alternative. Ano yung pwede kong gawin, di ba?
Yeah. Doc
Sige.
TP, nasasada
Yes.
ko doon, no? Pag nakikita mo yung mga call center agents natin, there are young people working so hard at night. Tapos nag-smoke break sila, no?
Pero
Nag-gather sila,
sabi
no?
nila kasi para magising sila.
Para magising sila, no? Ay, nako po. Ano po yan? Myth po yan. Hindi kayo magigising dyan. You're just destroying your heart, your lungs, and increasing yung chance of a stroke and cancer. You're working so hard, dapat po you should do smarter things with your time. Mag-exercise na lang kayo sa break ninyo. Huwag na kayong mag-smoke.
Okay. Makinig tayo kay Doc Erric. Wow, ang dami nun. Pero ang pinaka-tuwang-tuwa ko yung sinabi mo na yung iba sa atin biglang nagkaka-high blood pag nakakita na sa office or ano. Ito para sa kapatid ko, pag nakakita yan ng nakaputi, kagaya yung suot mo ngayon, biglang zhuk, tumataas.
The white coat. Okay.
White coat, yan.
Doc
Para sa
TP,
akin.
I wanna talk
Yes.
about that. Okay.
Oo.
May na-identify po kami. If you can imagine a 2x2 table, ha? 2x2 table. Plotting yung blood pressure mo sa bahay and blood pressure in the office. Ganito po yan. Pag normal sa bahay, normal sa office, sana all yan. Sana all normal talaga yan. Sana all yan.
Oo.
Pag mataas sa bahay, mataas sa office, naku, uncontrolled hypertension yan. Yung talagang dapat gamutin yan.
Both sides, mataas siya.
Oo, both
okay,
sides.
oo.
May pasyente
Ano
tayo kagaya ng the one you mentioned.
Ano to?
Pag nasa doctor na, mataas ang BP, sa bahay, normal yan. Ang tawag yan, white coat hypertension.
White coat. Ayan,
May
shout out kay
anxiety.
JP.
Oh, yeah.
White
Hello.
coat. Oo.
Alam niyo, yung white coat hypertension is an interesting phenomenon eh. Kasi po, alam niyo, may mga magulang, tinatakot yung bata sa doctor, bata pa lang.
Alam mo, totoo.
Nadinig mo na yun?
Sobra,
Pag bad
sobra.
ka, dadaling kita kay doc, papa-injectionan kita.
Tutusukin ka ni Doc.
Tutusukin ka.
Ganyan,
So,
oo.
nangyari ngayon, pag a certain age, meron kang innate na anxiety pag nabutingin ka sa doctor mo. Ganon.
Okay.
So, that's one of the factors. There are many, but that's one of them. Huwag niyo pong gawin yun, please, dear parents. Huwag niyo takutin yung mga
please,
patients sa doctor. Huwag ayaw magpabakuna, nagiging anti-vaxxer tuloy. Anyway, so, ano po, that's one. Ang tawag doon, white coat hypertension.
Eh, yung last na box.
Pero you know, Dr. TP, the last box is the scariest one.
Kasi ano to?
Ang tawag namin doon, masked hypertension. Nakamask ka na.
hypertension.
Masked hypertension.
Okay.
Nakita na po namin yan. There are certain patients, they love their doctor. They love Doc TP, ganun. Pag nakita nila sa Doc TP, their blood pressure goes down. So, normal yung
nagkakalma
BP,
sila.
ganun, normal. Pero pagdating sa bahay, I don't know their family life, pero taas ang BP sa bahay.
Dahil ba sa asawa yun?
I don't know, maybe. Pag hindi siya swerte. So, imagine niyo po yun, no? So, we said, merong true controlled hypertension, merong true uncontrolled hypertension, may white coat hypertension, and then may masked hypertension.
Paano mo ma-differentiate yun?
Home BP monitoring.
Home BP
So,
monitor.
according to studies po, delikado ang may mass hypertension. And simple lang po yung reason. Kasi you spend most of your time at home rather than in the office. You're subjecting your body to the high blood pressure more at home than in the office. And the doctors are hesitating to prescribe to you.
Okay,
Parang,
so, parang normal.
normal sa clinic ko. Pero sa recording niya, ang taas sa bahay yun. Nag-hesitate tuloy akong mag-prescribe.
Okay.
So, delikado yung mass hypertension. So, please, campaign po natin, invest in health, bili kayo ng magandang blood pressure monitor, see your physician regularly, and then take your blood pressure every now and then po. Thank you.
Ganda nun. Sige. So, and kailangan din makinig ng doktor, di ba? Kaya kailangan partner sila, yung doktor tsaka yung pasyente, di ba?
Partnership. I love that term.
Di ba?
Physician-patient partnership.
Correct,
I love
correct.
that.
O ito, Doc Erric, my father had a heart attack at 55 years old. I'm 40 and terrified I'll have one too. So how much does family history matter and what can I do about it?
Okay. I'm sorry to hear about your father, ha? we hear this story repeatedly. May patient pupunta sa amin, rightfully so, kasi nagkaroon ng close family na nagkaroon ng heart attack. Okay. So, ganun pa rin po, may genetic tendency ang heart attack. There are certain patients who are predisposed yan kasi merong family history. Tapos pag mali ang environment, mali yung mga daily habits, yan, lumalabas na yung heart attack. So you're doing the right thing. This is the first step. The first step is to recognize that your family has a history of a heart attack, so you consult early. Ang good news ko po sa inyo, with modern medicine, if you just follow the good advice, I hope you will not suffer the fate of your father and you will live a long, happy, healthy life without a heart attack.
Ang ganda nun. Hopeful pa din. Meron siyang
Hopeful pa
magagawa,
rin, yeah.
diba? You're not bound by your genes or your
Yes, you are
genetic
not bound
makeup.
by your genes.
Yes, eto. So, what's more important naman for heart health? Diet or exercise? If I can prioritize one, what should it be?
Okay, they are both equally important. Pero kung papipiliin ako which is more important, siguro I would say diet is more important. No, I guess.
Okay.
Pareho po sila important ha. Diet and exercise are both important. Pero ano po yung diet? Naku. Kasi nga po, di ba, you are what you eat. Food is medicine. Yan. Ano po eh. Whatever you eat that you do not consume, you store. Di ba, ganun yan eh. Tapos po, kapag po mali ang kind of food na kinakain natin, we are clogging our coronaries paunti-unti. Ganyan. Kaya, very important yun. Meron yung phrase ako nabasa eh, abs are made in the kitchen. Sabi nila, ganun.
Okay.
So basically, ang thinking, yung weight mo, kukontrolin mo yan ng diet, yung metabolism mo, kukontrolin mo ng diet, and then the exercise is to build muscle. Yan. So importante sila together, di ba? Importante together.
Hand in hand talaga
Hand in
sila.
hand,
No?
yeah.
And Doc Eric, ito siguro medyo magsisegue tayo. Sabi niya, I'm overweight. And
Yan
I
na.
haven't exercised in years.
Yan na.
So how much exercise do I need to protect my heart and how do I start safely?
Ayan. Oh, good. First is listen to your body. Do not force yourself to go on an exercise po without having some weight loss first. Get your diet in order muna. Alam niyo po, there are therapies, whether it's medication or yung simple meal planning, habits that can make you lose weight. To the listeners, meron akong gustong pro tip na sabihin sa inyo. Alam niyo ba na ang Okinawans, yung Okinawan diet, they don't eat until they're full. They eat when the hunger goes away. Ganun lang. Parang
When the
kakain
hunger
ka,
goes
kakain
away,
ka to.
paggutom ka lang,
Oh,
no?
you eat para mawala yung hunger. You don't eat para maging busog. Ang tawag nga nila, hara hachibu. Hara hachibu means you eat until you're 80% full. Ganun lang, buhay ka na sa 80% full and you will live a long, happy, healthy life. Tapos ito po yung habit. I'm going to bet TP na our caller. Mabilis kumain yan.
Oh,
Fast eater yan.
Siguro, no?
And with every subo, water ang ginagawa niya. Okay, so...
Ano yun? Ano ibig sabihin? Subo, inom, ganun?
Subo, water. Yan yung habit na delikado. Ang best way to eat is the mindful eating way. Kasi po ganito yan eh. When you're eating, the food stimulates your taste buds. Your taste buds will send a signal to your brain saying that, oh, may food is coming, your blood sugar is rising, you should stop eating na. Kaya di ba, minsan, Doc TP, there are certain foods na ang term ng Pilipino na uumay tayo. Ay, parang nabusog na ako kaagad kasi malakas ang lasa, ganun. So, take advantage of that po. Make it work for you. When you're eating po, chew your food slowly. Namnamin nyo siya. Saturate your taste buds.
Kailangan ma-enjoy nila.
Enjoy nyo siya.
Yes.
Don't drink water during the meal. Drink the water at the end of the meal. And magugulat kayo, habang kumakain kayo ng very slowly, nasa-saturate yung taste buds nyo, magkakaroon ng time to signal you to stop eating. Pero yung mga fast eater, hindi nagkakaroon ng time eh. Pagkasubo nila, chew and swallow, asan yung receptors? Hindi na stimulate. Tapos pag inom ng water, reset to zero. Clean yung receptors. So what
Okay.
happens? You tend to eat a lot. Nagugulat ka, dahil mong nakain. So going back to that hara hachibu thing which our Okinawan neighbors are doing.
Yeah.
Naku,
And sila yung mahaba yung buhay talaga.
sobrang
diba?
haba
Mga
ng
blue
life
zone
nila, no?
sila.
Oo.
Ganyan, oh.
Ang daming sa kanila, ang daming Apo Wangod sa kanila, no? Di ba? Hello, shout out to Apo Wangod, 107 years old and still
107 na ba siya?
107.
Wow, okay.
Kung gusto niyo maging Apo Wangod kayo, gayahan niyo yung mga Okinawan. Sa ginagawa nila, they have a healthy plate. Ang tawag natin sa Pilipinas yun, ang pinggang Pinoy. Yan,
Yes,
hanggang pinggang.
pinggang
Sundan
Pinoy.
niyo yung pinggang Pinoy, healthy yun. Ganun, healthy yung proportion. Tapos, pro tip, tanggalin nyo 20% of that plate. Yun yung 80%, di ba? Eat until you're 80% full. Get your plate, lagyan nyo siya ng healthy food, maraming gulay dyan, maraming isda dyan, ganyan. And then, remove 20% of that, eat that slowly, enjoy the company of, for example, si TP yung kasama niyo kumakain, enjoy the,
Wow, kailangan
the,
bagalan
the
din.
beautiful company, ganon, the conversations, ganon, enjoy niyo yung eating niyo, and then, pagkatapos you'll be surprised, the hunger will go away and you won't feel hungry at all, pero naging healthy diet. So, back to you. Pag nagsisimula ka na magkaroon ng weight loss, gaganda ngayon yung, sisigla ngayon ang katawan mo. Hindi masakit yung tuhod mo.
Okay. Yung
Now,
mga
magiging
kaso-kaso.
masaya mag-exercise kasi alam nyo, what stops people from exercising is pain. Ang
Yung
sakit,
pain,
no?
Oo.
Pag matagal ka na hindi nag-exercise, exercise ka for a while, the whole day, the following day, you feel lousy, ganun. So, they won't go back
So,
anymore.
kailangan dahan-dahan din. No?
Dahan-dahan lang, guided, ganun. Kaya natutuwa ako sa shout out to our wonderful fitness coaches who know what they're doing na parang hindi nila pinupush, no? Parang
Oo.
konti lang, ito lang muna, ganun gradual.
Pero na-encourage nila. Na,
Oo,
sige,
parang na-encourage
gawin natin
sila.
to. Yeah.
Ay, hindi yung push lang ng push, yung kaya mo yan, go, hindi ganun. But listen to your body, slow lang muna. O take a
Sakto
break,
lang.
water break. Ganun dapat, di ba? Ganun.
Oo. Gusto ko yung sinabi mo, Doc Erric, yung parang being mindful. Actually,
being
being
mindful eating, no?
of what you're eating, of your movement, di ba? Parang being present in the moment. Kailangan natin yan tandaan kasi ngayon lahat instant, lahat nagmamadali, di ba?
Yes.
So, sige.
Yeah.
Ito, Doc Erric, kasi medyo pressed for time na rin tayo. Gusto ko sana humingi sa'yo ng isang tip, pero bago, hindi na lang isang tip, i-show na natin yung parang nire-recommend ng Philippine Heart Association, yung 11 steps na para, ito yung pabaon natin sa mga listeners natin ngayong gabi, no? Ipapakita namin, may picture po kami ulit, i-share namin sa inyo. Pero gusto mo bang simulan na, Doc
Okay.
Erric?
Good evening, everyone.
Ulit?
Okay.
Naks naman.
Meron po tayong madaling mnemonic device na
Ayan.
tatandaan.
Okay.
Ang tawag po ng Philippine Heart Association ay PHA, puso muna. 11 bagay po yan na makakatulong po sa atin. Let us start with P. P, pagkain ng masustansya.
Yeah.
Ganda, no? Eat
Ganda.
nutritious food.
Yes. Ano yung H?
H, huwag manigarilyo.
Na-mention mo
Yan,
rin yan
oo.
kanina. Wala talagang benefit for,
Walang benefit
for
yan.
cigarette smoking.
Oo.
So, out na yan.
Out
sigarilyo.
yan. Quit
H.
smoking and avoid secondhand smoke.
Yes. Ano yung A?
A, aktibong pamumuhay.
Ano ibig sabihin nun?
Stay physically active and exercise regularly.
Yes.
Yan,
Okay,
malaking
PHA
bagay.
na yun.
PHA na, PHA na po.
Ayan.
Woohoo, PHA.
Okay, PHA.
Let's go to puso muna.
Puso.
P, presyon ay kontrolin.
Okay.
Monitor and manage blood pressure. Presyon ay kontrolin.
Sige. Ang U,
U, uminom ng maintenance. Yan.
ito yung mga na-diagnose na.
Oo, na-diagnose. Take prescribed maintenance medications. Mga kababayan. Prescribed by your physician.
Oo.
Mga kababayan, the best kind of aid or drug will not work if you don't take it. Yan.
Totoo yun,
Di ba?
no? At
Prescribe-
hindi ka pwedeng kumuha sa kapitbahay mo.
Hindi
tinitake
pwede.
mo.
Oh. So, uminom mo ng maintenance.
Yes. Eh, yung S.
S, sugar ay kontrolin. Yan. Monitor and manage blood sugar.
Yes.
Alam niyo po, masarap naman yung pagkain na hindi masyadong matamis. Tabangan nyo na yung mga kinakain nyo, pwede yan. Kaya yan, ano lang. Retraining lang yan. Kontrolin nyo yung sugar nyo. Monitor and then lessen your sugar intake.
Okay. Ang O naman.
O, obesity ay iwasan. Maintain a healthy weight. Similar to the blood pressure, your bathroom scale is your friend. Kaya hindi natin dapat iwasan yan. Magtimbang tayo kasi there's the only way para malaman natin yan, yung weight natin. So, obesity ay iwasan, maintain a healthy weight.
Mm-mm. Eh, yung M, punta na tayo. So, alam na natin yung
M.
PHA, puso, punta tayo sa muna. So, M.
M is matulog ng kompleto. Ensure complete and quality sleep. Kasi po, pag natutulog kayo, ang ganda po ng mga pag-aaral dyan. Your heart rate slows down, your blood pressure drops. Yun ang natural na rest ng puso nyo pag natutulog kayo. Pag hindi kayo nakakatulog, baka may sleep disorder kayo, obstructive sleep apnea. You should consult about that kasi may mga pag-aaral na po na risk factor po siya sa sakit sa puso, sakit sa utak, etc. Kaya yung mga malakas maghilik dyan, tapos hindi maganda ang tulog, you wake up in the morning feeling tired, naku, please consult a
signs yun.
sleep specialist.
Yes.
Get adequate sleep po, get adequate sleep.
Okay. Yung U naman, Doc Erric.
Another U is umiwas sa stress. Yan. Manage
ba yun?
stress effectively. Mahirap no?
O, manage stress. Kasi hindi na mawawala ang stress talaga, di ba?
Yun nga po Alam niyo po yung payo lang namin regarding stress. Ano po kasi yan It can be internal. Nasa external kasi po yung stress, iba? Nasa labas, nasa news, nasa labas yan You cannot control what's outside, pero you can control the way you perceive it and the way you react and respond to the stress. Ano po yan? Maraming ways to relax. Find what works for you and recognize lang po na if you're stressing yourself out too much, baka kayo po you're being too hard on yourself. Ganyan. So, iwas tayo sa stress, manage your stress.
So, love yourself din yung message dyan, di ba? O sige, yung N naman, Doc Erric.
Okay, no to alcohol. Avoid alcohol for better heart health. Kasi po, yes, you will read studies na among certain European
Wine daw,
countries,
diba?
maganda raw yung wine with every meal, ganun, okay daw. Pero alam niyo po, in the long term, ang alcohol din po kasi is a poison to your heart. So too much alcohol can be bad for your heart. Kaya kung kaya niyong iwasan, especially kung ang purpose lang naman yung social drinking, pwede naman magkwentuhan na lang kayo without an alcoholic drink, diba? So as much as possible, no to alcohol.
Yes, and yung last, yung letter A.
A is ayawan ang cholesterol. You should control cholesterol levels through diet and lifestyle. Alam niyo po, ang palaya is your friend. Ang sarap-sarap ng gulay, ganyan. Ang sarap ng fish,
agree.
diba?
Yes,
It's just a matter of controlling it. At meron akong, pwede mag-joke.
Sige, joke naman. Joke time!
Hindi hypertension ang topic natin yun, no?
Ano?
Ang topic, heart attack,
Heart
diba?
attack, yes,
Pero
heart
common
attack.
question sa amin Doc, bawal po ba, masama po ba ang salty food sa may high blood? Ang sagot, opo, masama po ang salty, it's asin.
Corny joke. Okay, go.
Pwede na rin yun, asin,
Pwede
diba?
na, pwede na.
Okay ba?
Okay, sige na nga. Pagbigyan
Pagbigyan
po.
niyo na.
Kasi guest natin tonight, pagbigyan po natin si Doc Erric. Pero, Doc Erric, maraming salamat for that life-saving conversation. So, kailangan natin tandaan, no? PHA?
Puso muna.
So, meron pa silang mga, para madali nating matandaan. So, 8 o'clock na. Pero bago tayo magpaalam, any final words? Ang bilis ng oras natin, Doc. Any final words sa ating viewers at tagapakinig ngayong gabi?
Well, thank you to you, Doc TP, for this wonderful invitation to all our listeners po. Invest in health. PHA, puso muna.
Wow. Sige, madali namin matatandaan yan. Pero thank you, Doc Erric, for that message na ibabao namin, pag-uwi namin para pwede po kayo mag-refer ulit sa ating recording, sa ating Facebook, no, kung kailangan nating i-review. Pero yung conversation ngayong gabi, dami ko natutunan and I'm sure mga listeners natin, marami ring natutunan. So, thank you everyone for listening and tandaan po natin, this isn't just information, this is life-saving knowledge. Share it with your family, your friends, your colleagues, no? And until next week po, take care of your hearts. They're working hard for you every single second. I'm Dr. Tipi Sumpayco Tanchanco, and from Cura, stay heart healthy, Ateneo. Magandang gabi po sa inyong lahat.
Health isn't just about medicine.
It's about care
Community
and conversation. That's why Radyo Katipunan brings you Cura, your campus medical show.
From everyday wellness tips to expert advice on the health issues that matter most to you.
Cura is here to listen, guide, and care
The Ateneo way.
Join us as we talk about healing
Hope and health right here on Radyo Katipunan 87.9 FM.
Cura, your campus health companion
Where care